My name is Ariel Dadich. After many years as an experienced special education paraprofessional with a bachelor's degree in behavioral science, I have transitioned into a career in data analytics. I'm grateful for my time at DevMountain and the personal and professional growth I have experienced while in bootcamp, and in particular throughout the data analytics course. I've chosen to focus on COVID-19 for my capstone and final project. I'm passionate about this because, like so many, COVID-19 has directly impacted my life. My twin boys were born prematurely and are considered high risk because of their lung development. It is vital as a parent that I have accurate information to make well-informed and safe decisions for their health and well-being, as well as for the rest of my family. This presentation looks objectively at two different data sets, offers hypotheses and their corresponding answers rooted in statistical research, data analysis, and visualizations. Some of the technologies and coding languages I utilize include Python, Jupyter Notebook, Pandas, Matplotlib, Plotly, SciPy, and Seaborn. I've also listed my GitHub information and link if you're interested in viewing the data, EDA, and code for this project in its entirety. Before jumping in, I'd like to point out the differences between correlation and causation. Correlation can be defined as a statistical measure that expresses the extent to which two variables are linearly related, whereas causation explicitly applies to cases where action A causes outcome B. This is vital to note because all of the visuals and data I will present depict correlation. For example, the data shown in this scatter plot displays a real correlation between testing positive for COVID-19 and death. However, as we all know, testing positive for COVID-19 does not explicitly cause death. With that understanding in mind, let's continue. This heat map shows the correlation between individuals who test positive for COVID-19 and increased ICU and hospital admissions. The stronger the correlation between the variables, the darker the hue. In this example, we're examining data surrounding total cases, positive rate, ICU patients, and hospital patients. Additionally, we can examine this correlation in greater detail in this 3D scatter plot. This allows us to view the positive rate along the x-axis, the hospital patients along the y-axis, and the total cases along the z-axis. This can help us easily decipher and quickly understand the correlation between all of the data presented. Okay, moving on. This heat map allows us to see the direct correlation between age and increased mortality rates. This data and visualization focuses on those whose age is 65 and older, as well as aged 70 and older. It's apparent as age increases, so do the fatality numbers connected with COVID-19. Lastly, this heat map visualization focuses on a country's overall vaccination rate and the effect it plays in the country's mortality rates. This dataset required some additional exploration, filtering, and shifting because the CDC released the information that the vaccine isn't fully effective until 2 weeks after the second vaccine dose is administered. Therefore, the date of vaccination and the date of death are not a one-for-one comparison. So in order to present the data in a more accurate way, I offset the vaccination dates to account for any lag in vaccination efficiency times. I presented data shifts for both 1 and 2 week time periods, and in doing so, this allows for a more clear and accurate representation and allows us to quickly deduct that the country's overall vaccination rate does in fact directly correlate to that country's mortality rates, as shown here. I'm really proud of the data analysis, visualizations, and scientific correlations I completed for this project. And in the future, I'd like to learn how to use Tableau. This would add to my data presentation and visual storytelling arsenal, as well as allow me to capture COVID-19 data as it's updated in real time, as opposed to just being limited to static CSV files. But I really appreciate your time, and thank you for watching.